Hey everyone, you're watching a sample that's coming from our Home Health Marketing Bootcamp. That's right, over 7 hours of amazing content that's going to be able to help you guys learn what steps you need to take in order to become that preferred provider. So just want to let you guys know, please make sure you stop by 10xpatientreferrals.com and sign up for this bootcamp. It is only available for a limited time at this moment. Typically a lot of marketers, a lot of, agency owners will go out there and market, and when they get asked, tell me about your company, we are normally going to jump into the whole hoops of the wrong way of marketing. We're going to say, I'm so-and-so with ABC Home Health. We provide skilled nursing, physical therapy, so-and-so. These are the services we offer. We definitely want to see if you can try us out. The problem is we're automatically asking for that referral because we think that we presented, we think that we did such a great job that they should start referring to us. When that right there is the number one mistake of presenting, is to all of a sudden not give enough value that you think you can ask for a referral. Just because you came in the door, just because you gave them the pens, just because you gave them mugs, just because maybe you brought some donuts, or just because even you did some lunch and learns. It is completely far from the truth that that's what you need to do. It's about building value. There's a book, and I'm probably going to reference this book several times in this whole training, called Jab, 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 Right Hook by Gary Vaynerchuk. And his whole concept is that everyone is always trying to do the right hook, getting that sale, getting that referral. When the truth is, we need to jab a couple times. I mean, if you watch boxing, I'm not too sure if you watch boxing, but in boxing they say, jabbing is probably one of the most important punches, even though it's not as strong. It sets up for you to create the right hook, to the knockout punch, as they may say. So just like in marketing, the jabs that we give are the value that we can provide, the things that we can provide for them, the ones that we can say, hey, this is who we are, this is what we're about, this is how we can help you, this is how we can help your patients, this is how we can ease the process of you referring a patient to a company like ours. And then eventually, if you give so much value first, then what's going to end up happening is, in turn, you are then going to get that referral. And you might not even have to give them the right hook and say, hey, try us out. The truth is, I don't ask a place to refer patients to us until I visit them at least 3 or 4 times. In my team and I, the people that I train, or companies that we actually consult for, we teach them, you shouldn't ask for a referral the very first time. You going up there, you being a home health agency, a home care hospice agency, it already should be clear enough that you want patients. What you need to do is you need to build value, because people that you know right now, people that you love, people that you respect, people that is surrounding you right now, you trust them because they did something for you that earned your trust. So we can't expect people to trust us if we have not earned their trust fully yet. And so that is what we're going to spend time in. That's why it takes a process, right? It takes a process when you meet somebody and then trust them, right? You meet them, you find out more about them, they share something with you, you have something of similarity with them. People like themselves, right? You share similarities, you share stories, you share struggles. You help each other for certain things, whether you help them move or you have a great idea for them, whatever it is, you build trust through that. And most of us think and feel that me going in and do a quick presentation is what's going to get me a referral right away. And that right there is why people succeed in marketing in home health and people don't. But if you know and you figure out the blueprint, the step-by-step process to increase your chance, and it's not going to be 100% foolproof, but if you know the system and you can analyze it and you can slowly work on it, then that right there, my friends, is what's going to give you guys the edge over your competition, is being able to know what to do. And then the next thing we want to be able to look at is this and understand this, is that marketing is 100% of your province. Yet, most agencies don't even have a marketing budget. They don't even have a set forth. Like, I'll tell you guys how many times where maybe 1 out of 10 agencies, I'll ask them this, I'm like, okay, they're struggling on getting patients, they're struggling to get those clients, they're struggling to get referral sources. Brought to you by our partners at homecareansweringservice.com and medicationreminderprogram.com. So medicationreminder.com, what they do is they can actually call your patients twice a day to remind them to take their medications. This lessens the chance of them being readmitted to the hospital. At the very same time, it provides value. It lets you show your referral sources that you are different, that you want to provide more services for your patients. It works amazingly for home care, especially with home health agencies. So look into this. It's a great thing for you to add for your company. They have 3 different plans, but later on we're going to share with you guys a way to be able to save even more. The next one, homecareansweringservice.com. Listen, at nighttime when you get a call from a patient or maybe even potential referral source on the weekends, sometimes you're not able to answer the call right away. At the very same time as you can save money, instead of hiring somebody to do your call answering, you can have homecareansweringservice.com handle this for you guys. At a low basic plan of $39 a month, they will handle your calls, especially in the weekends, especially at nighttime. You may have a manager on duty who's in charge of that phone, but at the very same time, at nighttime, they may not be able to answer the phones for you. So sometimes when a patient calls at night, a family member, if you miss that call, they may end up in the hospital or you may lose that potential referral. Now, don't forget, we have our live marketing bootcamp events happening all over the United States, but we have now our online marketing bootcamp available, so make sure you take advantage of that. Go to 10xpatientreferrals.com and check them out. So these are some of the cities that we're holding a lot of our events. We rescheduled them because of the whole COVID scare. Please make sure that you pay attention. The dates may change at this very moment, but please check with us. Now, here is how you can save some time. So at 10xpatientreferrals.com, we have an online learning platform, teaches you everything about marketing. Okay, so we have 3 different packages. As you guys can see, if you guys choose the gold plan or the platinum plan, you're going to be able to get some free service from Home Care Answering Service as well as Medication Reminder Program. But if you just choose the silver plan, it's still great. You're still going to get 25% off the Medication Reminder Program or 25% off on the answering service. So please, 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 please let us know how we can actually help you. This is Michael with Home Health Success Academy. Always understand, marketing is easy when you know what you're doing.